Hi, I'm Jim Berenson from the Institute for Myeloma and Bone Cancer Research. I'd like to discuss with you today myeloma bone disease. The bone is the most important part of what happens to a myeloma patient clinically. Why? Because the bone marrow where myeloma resides is right next to bone, and often the bone marrow itself, when crowded with myeloma cells, causes negative impact on the bones. And how does that occur? Well, it occurs because there are types of cells in the bone marrow that stimulate Pac-Man cells to gobble up bone. So what does that do? It weakens the bone. So patients have fracture. The bones can expand as well, so patients get bone pain. And this often leads to the requirement for surgery, perhaps radiation, and sometimes the spinal cord can be impacted by crushing of the vertebral bodies in the back. That can lead to more serious consequences like paraplegia. So how do we stop that from happening? Well, there are multiple ways we can do that. Easy ways, such as maintaining your vitamin D levels. Have your doctor check that, and you should be taking supplemental vitamin D and calcium. Although calcium levels can be higher in severe bone disease from leaching of the calcium out of bone, most patients actually require supplemental calcium. So the use of calcium and vitamin D are most helpful in maintaining bone strength. Second, there are drugs we use today to help with this. First, we had bisphosphonates. Early days was Iridia. More recently, over the last 20 years, it's been Zometa. A monthly infusion makes those bones stronger. How does it do that? It eliminates those Pac-Man, stops them from gobbling up bones. So the bones are stronger and less likely to fracture. We also know there's a newer brand called Xgeva or denosumab, an antibody that prevents the osteoclast, that's the cell that gobbles up bone, from acting. When that is gone again, the bones are stronger. So one can use either of these classes, bisphosphonates or the Xgeva, but the Xgeva is markedly more expensive, not really more active, but it doesn't have kidney problems. So among patients who have kidney problems, we now have an option. We have Xgeva. In addition, it's important for the myeloma itself to be treated because eliminating the myeloma cells in the bone marrow prevents them from stimulating the Pac-Man from gobbling up bones. Thus, we have a multi-pronged approach in myeloma patients to prevent bone loss, fracturing, and bone pain. We have vitamin D, we have calcium, we have drugs like bisphosphonates and Xgeva, and then we have treatment for the myeloma itself. As a result of this multi-pronged approach, bony complications have been markedly reduced among myeloma patients over the last 2 decades.